So in this video we're going to be talking about the different individuals who are involved in healthcare. So just to give you an appreciation of why it's called MDT, or multidisciplinary team meeting, or multidisciplinary team. So this will help you answer the question of other than doctors and nurses who are also involved in the patient's health. So let's start with the first one, which is of course doctors. So the job of the doctor is they see the patient, they help make a diagnosis, they make a management plan, and based off that management plan will then determine how you take care of the patient and what jobs the other staff members will do. For example, nurses, what kind of medications they will administer. So we have our nurses. So there's many different types of nurses. You have the general ward nurses who do the ward duties of the nurse. For example, the main one would be administering medications that the doctors have prescribed. They can also be involved in discussions with the doctors and other healthcare staff to ensure a holistic approach to the patient's care. For example, if the patients have any concerns, it'll often be the nurses who are the first point on call, who then raise it with the doctors if appropriate. Nurses can have other tasks as well, like cleaning the patient, helping mobilize the patient. Then you have other nurses, for example specialist nurses. You have respiratory nurses, who any patients that have particular lung conditions like chronic obstructive pulmonary disease or COPD, we often get respiratory nurses come and review them before discharge, and then they might see them as outpatient in the clinic. You have diabetes specialist nurses, so anybody whose sugar levels are out of control whilst they're in hospital, we can have the diabetes specialist nurse come take a look. So many different types of specialist nurses. Then you have nurses who act as the ward manager, so they basically oversee the running and just the way everything's functioning at the ward level. They oversee all of that, so they're responsible for taking care of and managing the nursing staff. You have the charge nurse as well. So a charge nurse has a pretty similar role, but their duties, usually a charge nurse, the duties are for when taking care of staff, it's the ones that are on the shift at the same time, whereas a ward manager might take care of other things beyond that. So well-being, all of these kinds of things for other members of staff. So then you like student nurses. Then you have the cleaners. So cleaners are very important because infection control is very important for the safety of the patients and safety of staff as well. Many infections like gastroenteritis, the stomach bug, very easy for it to spread around, especially when things are contaminated food, contaminated surfaces. So if the cleaners don't do their jobs properly, it's very easy for infections to spread and disease. There's people who they can die from these kinds of diseases, especially elderly patients who are immunocompromised, meaning their immune system's weak. Those people are highly susceptible to infections, so it's very important that we have cleaners cleaning the place. Then we have pharmacists. So pharmacists are involved in medication reviews in the hospital or in the GP. They'll review all the patient's medications, see if any amendments need to be made, if there's any mistakes, and if there's any problems they can raise you up with the doctors. They're also responsible for managing the stock. So if there's nothing in stock, then we speak to the pharmacy. They then get us stock for medication. They're also involved in discharges. So when the patient's about to get discharged, we write up a summary. This will involve a letter explaining what's happened during their stay and a summary of their medications and what medications they're going to go home with. It's the pharmacist's job to then review those medications that we put on their discharge summary to make sure that they're safe to go home on these medications. And if there's any problems, then they'll raise you up with the doctors. And they're also very useful if you have any queries about medication. Then you have the dietitians and the SALT. So SALT is speech and language therapy. So they usually go hand in hand, because when there's a swallowing problem, we get the speech and language therapist to come and review them, check if they have a safe swallow. Because if they don't have a safe swallow, usually that means they can't meet their nutritional requirements. So this is when we get the dietitian. You can have dietitians in other for other reasons as well. For example, if a patient's got dementia and they're just not tolerating solid foods because they just don't want to eat, so the dietitian could come and make a plan, provide things like nutritional drinks. So you have drinks that usually about 200 ml bottles, 40 sip. Ensure juice 200 ml can have about 300 to 400 calories. It contains all the vitamins and minerals that you need, the protein, etc. So the dietitians, often they'll make a plan to help the patient either gain weight or maintain weight, and we then prescribe whatever they've advised on the prescription chart. And then of course the SALT team, so they come and review a patient's swallow. If they have any speech problems, they'll come and assess that as well and just help them with that. They might do exercises to help a patient learn how to basically swallow better. For example, if they've had a stroke and their ability to swallow has been weakened, SALT team can come and help them with their regaining function. So you have the physiotherapy and the occupational therapist. So physiotherapy are involved in helping the patient mobilize, getting them in and out of bed, back and forth to the toilet, up and down the stairs, making sure that they're able to mobilize as appropriate. Occupational therapists are people who assess the home situation. For example, a patient who is now bedbound, how is that going to affect their home life? Or will they have their needs met at home? Or do they need like a care package? Do they need things moving about? For example, if a patient can't walk up the stairs anymore and the bedroom's upstairs, can the bedroom be moved downstairs? So they look at things like this. You have the discharge facilitator. So all these individuals are involved in the discharge of a patient. So the doctors, nurses, the pharmacist, physiotherapy, occupational therapists, any social services. The discharge team or the discharge facilitator oversees all of that, and they help liaise with these individuals. And it might be a patient needs to go to a care home, so the discharge facilitator will speak to the care home and so help maintain that communication between everyone. Ward clerk and secretaries, so they deal with a lot of admin, and they're very useful for if you want to make a referral to somebody, getting into contact with that individual that you want to refer to. For example, if I need to make a referral to the diabetes team, I'll then speak to the diabetes secretary and ask if I can hand in this referral to them, and then they will then book an appointment for the patient or speak to the diabetes team to get them to review the patient. So ward clerk has similar duties, and there's a lot of other admin work that goes on. So then you have security. This is just for the safety of anyone. You have patients who have dementia, patients might have psychiatric issues, and they might get aggressive, and so we need to call in security for their safety and the safety of everyone else. You have radiology. So these are the people that perform the scans, so x-rays, CT scans, MRIs, any scan that we refer to a patient, it goes to them, and then they have to vet the scan, meaning they have to accept it, and then they do the scan. Then you have the bed manager. Bed managers basically oversee the bed space or bed capacity available within the hospital, and they help shift people about as appropriate. Usually there's an 80 to 20 rule, so 80% bed space occupied, 20% should be unoccupied. The reason why is because if you need to move someone, like if someone needs to go to ITU because of an emergency situation, if someone's developed an acute lung problem and now we feel they need to go to the respiratory ward where they'll be managed by lung specialists, it would be helpful if that bed space was available so we can shift people about. And then there might be an emergency, for example, a massive fire in a hotel, and now loads of people are coming to A&E with serious injuries. we'd need space to accommodate these individuals if the need arose. The pathology lab are people who process all the samples we take, for example, blood samples, tissue samples. We send it to them, and they have also machinery. They then obviously produce results from that, and they hand us the results which we use to analyze patient situation. Social services. So they're involved in the social aspect of things. For example, if it's a 14-year-old who's come in because of problems in the house, maybe they've suffered some kind of assault, so then social services will be involved to see if it's safe to go home. So they deal with safeguarding concerns and just safety issues for the patient in the social context. Then we have the HCAs. HCAs, there's different types of HCAs depending on what level of training they've had. Some HCAs can't take bloods, but some can take bloods. Some can do cannulas. HCAs, they help the nurses with their jobs, so providing food for the patients. They can help just clean up the bed, clean up the patients. For example, if the patients had an episode of diarrhea, HCAs can help clean them up. They can do observations, so checking the oxygen, heart rate, blood pressure, all of these things, and to make sure that the patient's stable and safe. So this is not a complete conclusive review of all the people that are involved, but this is just an example of the different types of staff that you can expect to encounter while working as a doctor, just to give you an appreciation of how many people are actually involved. There's far more people involved, but as long as you have some of these in mind, you shouldn't have a problem answering this question. So thank you for listening, and just like and subscribe, and there'll be more videos coming soon.